So today I'm going to instruct you how to use an Advair disc inhaler. It's prescribed for COPD and asthma. It's dosed as twice a day, so you want to take it once every 12 hours. Now the Advair is the brand name. The generic drugs in here are salmeterol and fluticasone. Salmeterol is a long-acting beta agonist. It will open up your bronchioles, and the fluticasone is a corticosteroid, and that will reduce inflammation in your lungs. So to use this device, what you want to do, you always want to make sure you hold it like a hamburger. I know it's kind of an odd shape, but you always want to make sure you hold it like a hamburger, hold it flat. And on the front you can see that there is a dose counter. So unlike with other inhalers, you don't have to manually count your doses. It will tell you how many are left. And once the dose counter gets down to, I'd say 3 or 4, you want to make sure that you contact your pharmacy to refill your prescription. So to load the dose, to start off, what you want to do is you want to put your thumb in the thumb groove and rotate it around until you hear a click, and that will expose the mouthpiece and a lever. Now to load the actual dose, you want to slide the lever back until you hear a clicking noise. Now the important thing is, once you hear the clicking noise and once you load the dose, you want to make sure not to tip the inhaler down, otherwise the powder will fall out. Now to administer the dose, you want to first exhale away from the inhaler. That is to not blow the powder out of the inhaler. You want to exhale fully away from the inhaler, and then put your mouth and lips close and tightly around the mouthpiece and inhale fast and deep. After you do that, you want to hold your breath for 10 seconds to make sure that the medicine takes its effect. And an important thing to note with this is it does include a corticosteroid in the inhaler. So you want to make sure you rinse your mouth out very well after you take a dose of the Advair. Otherwise you could see some white plaques in your mouth, and you would definitely want to see your physician if that ever occurs. Some common side effects that you may experience with this is some mouth or throat irritation, some upper respiratory effects, or maybe even a headache. Those aren't things to get alarmed about. You should more or less be more concerned and contact your physician right away if you get the white plaques in your mouth. And to prevent that, you want to make sure you rinse your mouth out after every use. So I hope that helps, and good luck using your Advair inhaler.